We're back. I'm back.
Hello, and we
Welcome.
can hear you this
I
time.
am so sorry. I changed rooms. I'm not sure why my internet went down. I live out in the country, so doesn't always work out here too good. But anyway, sorry about that. What I was telling you guys is about this project that they have at the University of Maryland, but there's also it's the Lord Baltimore Hotel, and they're calling it the Lord Baltimore Tri-Center. And at the Lord Baltimore Tri-Center, it is a project with the City Health Department, as well as University of Maryland. There are social workers, so there's people working from the health department there. And the whole idea behind Lord Baltimore is to have housing to stop the spread of COVID-19. So that individuals, that 2 of the floors are devoted just to homeless people, so that they have individual rooms. The meals are served directly to the patients in their rooms, or they're considered clients, residents. So meals are delivered, all 3 meals. Then the other floors, what we call the hot zone, are residents that come there from different congregate living places, such as we have a lot of, and I had no idea Baltimore had so many different congregate living settings. Some of them are boarding homes, but a lot of them are rehabilitation centers for people with drug addiction. And so if they've been exposed to or they're testing positive, they come and they stay at the hotel for up to 2 weeks while they're recovering from COVID-19 or in quarantine. So it's public health at its finest, protecting society at large, because rather than the disease just continuously spreading and spreading, they are individual rooms. And so some of them are families that are living in rooms, but it is really, it's pretty remarkable, really, what they have going there. And so, yeah, and then of course they have the field hospital and the infusion center and the testing and the vaccination sites. But this is all community settings, preventing the spread of illness. So I've changed rooms, so I got to find my notes now, and I don't have everything that I have in my office, but as far as my other computer to refer to, but it is what it is, as they say, right? All right. Okay, so I think we've talked pretty well about roles and community settings. If anybody has any other thoughts about it, you can either comment now or comment later. But what I'd like to, I have a couple class activities for you to do today. And the next part of the lecture that we talked about was, and this will be one of your activities, is complementary alternative medicines, or CAM. And so I'll break you into your groups again, and I'll have you work on a CAM activity. And I did open up that folder so that you'll be able to do this activity. So why don't we go ahead and do that activity, then we'll come back and we'll talk about CAM, and then we'll spend the last hour or so, depending on how much time we need, with the in talking about infectious diseases. Okay, does it sound like a plan? All right, so let me do your breakout rooms again. And so I had all this set and assign manually.
So Ms. Bunting, are we doing all 4? Are you going to assign which topic you want us to do?
So each group has their own, so you can see I have, again, the problem is that's all on my other computer. Why? right? No, I want you to just do the one assignment. So,
Also, I see in the Word document for the CAM presentations, is that what we're about to do? It says
yes.
group 1 is chronic pain, group 2 is anxiety, group 3 is the common cold, group 4 is cancer.
Okay, so the first group is Princess, Riley, Mackenzie, and Sierra. Is that right? I think that was group 1. Group 2.
I believe we were group 1 last time, yeah.
Yeah, who was group 2 last time? Read your names, or somebody tell me your names and I'll put you in to your groups. Go ahead, Phyllis, who, are you group 2?
Yes.
Who else is group 2?
It was Orlando, Abriana, and Diana.
Okay, thank you, because that's on my other computer, which I can't see from my dining room. Okay, next group.
It's Christian, Christine, I'm blanking, Phoebe.
Okay, who else was in this group? Samantha, Olivia, Natalie, Chuck, or Carol?
I was.
Who's I? Carol?
Carol.
Okay, that was group 3, and then group 4 must be Chuck, Natalie, Olivia, and Samantha. Yes?
Yep.
Okay, your rooms are opened. Let me close for a second so I can talk to you. Oh my gosh. Okay, guys, so you know what you need to do? You see what each of you have as far as, can you hear me? Okay. So work on that for about 10 or 15 minutes, and then we'll come back and do our presentations about CAM, because this is very much, because CAM is so much a part of our everyday life and people are using it. That's why you need to be aware of it and use it. And I'll talk about the readings that Carol had brought up to me also after we all come back together, okay? So I have to reopen them. Can I stop that? I didn't know if you guys could hear me. Teaching in the time of COVID is really a challenge. Okay, open all rooms.
We're done.
Yes? Okay,
I don't know why I came back. I just came back.
well, because I made a mistake. I
Oh,
thought I
okay.
could only talk to all of you by closing the rooms. Are you all
Oh.
in your rooms now?
Well,
Yes?
no.
No.
No?
No.
Yeah, it looks like everyone from group 1 except for Sierra is here right now. I don't know how to join.
All there now? Who's missing?
And we're missing 2 people. We're missing Riley and
Yeah,
Princess.
now Riley's missing.
Because now you're just in our group and not in the whole class.
I know. Oh my God. I don't know.
So that'll get back and forth.
I don't know what the heck. Where's Riley?
He was telling everybody how to join their breakout groups. So everybody went back to their breakout groups.
All right, we're getting there, guys. Love it. Love, love, love it. Love in the time of COVID. Oh my God. All right. Is everybody there now? I'll check. Is everybody in their room?
Yes.
Okay, so you're good with your assignment then? I'm just trying to figure out if everybody's where they need to be. Are you all where you need to be?
Yeah. Are we
Okay.
supposed to just use the CAM visual chart to answer the questions, or we want us to like look it up?
Look it up, find some, the CAM visual chart is just really just sort of summarizes it, but you may need to do some evidence-based, some research. So look on the web for some research, okay?
Okay, thank you.
All right, and let me just make sure these guys are good. Hello, are you all good? And
Exercise.
everybody there?
So we're missing Chuck.
Oh, we're missing Chuck. Okay, let's see if I can find him. Okay.
Okay, he just texted. He
Said he
said,
got booted out.
yeah, he said he got booted out of the meeting and you need to let him back in.
Okay, I need to let him in
Yes.
if I can find room 4. Okay. See if I can figure it out. Okay, I've got it here. All right, breakouts. Okay, I'm gonna leave this room. Hopefully it won't. Find Chuck. Okay, Chuck, I'm trying to get you back in there now.
First, I was in a room by myself, and then when we came back, and then I got booted off, and
Oh my gosh.
I don't know what's
All right,
going
let's see if I can get you back. I don't know oh, there you are, Chuck. Okay, assigned to your room 4. There you go. Now you should be in room 4. Chuck. Okay, now you should be there, Chuck.
I'm
You're
okay.
there
I'm okay with
now?
it.
Okay, cool. I just want to
on.
make
Here,
sure.
thank you.
All right, everybody good now, what you need to do? All right. I'll leave the room so you can do your work, okay. This is absolutely Everybody back? Hello, hi, okay, so, why are we spending this much time on complementary alternative medicine? What's important for us to know about CAM as nurses? What's the important piece?
The interactions with the Western medication to make sure it doesn't cause harm to our patients because they use it so much.
Right. Okay, very good. Anything else?
You can try to verify it with like cultural beliefs. Some people might be taking that instead of actual medications.
Mhm. So how do you handle that? If somebody won't take regular medicine, but only want to use alternative medicine, what would be, how could you work with that patient?
I would respect their decision.
Okay,
And also educate them about the usage of like the CAM therapy
about the what therapy?
alternative.
Okay, okay, so would you, so yeah, you would definitely respect their choice, but would you want them to stop the Western medicine or altogether? How would you
I
handle
would
that?
If it's
educate them to let them know why they're taking the Western medication, but of course I can't like shove it down their throat and tell them you need to take this, but I would just give them like a good teaching.
Exactly. So educating the patient to, and so that they understand why they're taking, why there's and typically what's Western medicine, it's almost always medication, right? We have all these other alternative options, but in Western medicine, a lot of it is medication based. So teaching a patient how to integrate both their choice of an alternative treatment with the Western medicine. Okay, so education, once again, is key there, isn't it? Okay.
I was wondering if I could just say a piece about this, because I feel like this is closely related to what I was studying over the winter at Towson.
Okay.
I wrote like a long paper, which was a group project about indigenous health practices of people indigenous to the Americas or Native Americans. And one of the core themes, which came up again and again in like decades of research. Sorry?
Natalie, turn your mic off, please.
Sorry, I'm sorry.
Go ahead.
Yeah, sorry, a theme that just came up again and again in research was people desiring a greater integration of their traditional health practices with Western medicine, but feeling as though those practices were not respected by Western practitioners. And I just think that's a useful thing to keep in mind if you are trying to encourage someone to, accept Western interventions, which they may find desirable, but they just also want to be respected, in their traditional practices. That's my piece.
Absolutely. No, you're absolutely right, because really it's only been in probably the last 10 or so years, maybe a little more, maybe a little less. I'm not 100% sure, but we haven't wanted to integrate both the Eastern and people's choice based on their own culture. And a lot of it is very cultural. I think we're getting better with that, but you're absolutely right. We have to find a way to not only respect the fact that people do have choices, and many of those choices may not be what we personally would choose, but it's not our choice. Our choice is to ensure that we respect and that they can find a way to integrate their own personal practice into the Western medicine. So yes, it's a very, very good point. Any other thoughts about that? If not, we can go ahead and do our presentations. Let's start with group 4. We'll switch it up a little. Group 4? Do we have someone from group 4 here?
Yes. Yeah.
Okay,
Yes.
there you are. Yep, I see you. Okay.
Okay, so do I share the screen or just read
You
what we
can,
have?
sure, you can share the screen. That's great.
If I can figure
if you can.
Okay, I give up. All right, I'll just read it.
Okay.
Okay, so we had, what is the therapy? We have acupuncture. And research shows that, and the NIH states that acupuncture relieves nausea and vomiting associated with chemotherapy. It also may help reduce pain.
Okay, so wait a minute. Let me just go to your presentation. Your group 4. So your topic is cancer.
I'm sorry, cancer, I'm sorry.
Okay, that's okay. Go ahead then.
Okay, sorry, I'm reading and trying to flip back my screen here. Okay, so we chose cancer. So then 3 was asking how and why it is used for the problem. It is used for relaxation and help make improve digestion and also assist with stress management. The pros and cons to it, we had the pros would be pain relief, also releases serotonin, provides stress relief, and promotes good digestion. The cons would be it doesn't treat the disease, but just the symptoms, and also another con would be accessibility to getting the treatment. You also may have some like soreness, minor bruising.
Am I losing you guys again? Oh my gosh. Okay. Can you hear me, ladies and gentlemen?
And we have for the seizure disorders.
I've lost you guys again. I am so sorry.
Professor?
Yep. Can you hear me? All right.
Monty can hear us?
Yep. I can hear you guys. Can you hear me?
Yes.
Yeah, I heard that.
Okay.
So
I'm so sorry.
done.
What the heck? This is like the worst. I am so sorry. Technology. Can you hear me? No. All right.
Mhm.
Yes? Maybe. Can you see me? I don't
Yes.
know.
Yep, I can hear you.
You can hear me? Don't know why I'm having such difficulties today. I apologize profusely. I think it's the
Yeah,
weather.
we can hear you. I see a lot of people nodding.
My connection's unstable, but if you can hear me, I'll tell you what, guys, so that we don't.
Probably lagging.
I think what I'm
Yeah,
going.
I think, Ms. Bunting, that you may be getting a bit of a lag on what we're saying, that we might be getting some lag from your end also.
She's completely frozen again.
It has to do with my connection today, and I'm not sure why.
Technology.
Terrible. Can you see me?
Oh, never mind.
I could try going in the other room again. It's, I don't know.
You don't think we can just finish?
Yeah,
It's
you guys can
recorded.
just go. I guess group 3 can go. We're
Okay,
listening.
guys, I'm going to try moving again,
Yeah, let's
and
make sure she gets back first.
can you hear me?
Yes, can you hear us?
Yes.
I can hear you guys. Can you hear me?
Yeah.
Yeah.
Okay.
Yep.
All right, so. What I'm going to ask you to do is keep presenting, and then if you have them written up, if you could just send it to me as an email attachment, then I can look at them, since this is not working as well as I had hoped. I'm not sure. I guess it's because we have so much ice and snow out here.
I just saw a little thing pop up that says that your bandwidth is low.
So what do I do to improve bandwidth? What does that mean? I don't even know.
Is anyone else in your house using the internet right now, particularly for something like streaming a video?
No, my husband doesn't use internet. He's not a tech person at all.
Well, neither am I. That's my only suggestion. So
Yeah,
maybe
okay, so
someone else
bandwidth means how much I'm getting in, like technology wise, it doesn't matter, whatever. I'll try to fix it one of these days. Okay, so group 2, what was your topic?
You skipped group 3, Professor.
I did, you're right, thank you, because I was going, group 3, what was your topic?
I'm trying to share the screen.
Okay,
If not, it's okay. Ours was common cold.
yeah,
So the therapy that we found was echinacea. So it comes in different forms. For the common cold, we assume that it's most likely oral echinacea. So like it comes in a capsule form.
okay.
The research showed that echinacea stimulates the immune system, decreases inflammation, and it's used to increase T lymphocyte, tumor necrosis factor, and interferon production. Going to number 3, the how it's used is ingestion of echinacea orally. The why, like I said, is treatment of inflammation. The book said it possibly treats viruses. And again, it stimulates the immune system. So the pros of this therapy, once again, stimulation of the immune system. Christine also found that it lowers blood sugar. I think it was Christine. It's cost effective, like you were talking about in your voice thread. And it's also available without a prescription. And it's available in many forms over the counter. The cons from the literature says that it decreases effectiveness of meds for things like tuberculosis, HIV, and cancer. And it can also have a bitter taste. Some people have allergic reactions, and it has possible GI manifestations and can result in fever. The interactions, like I talked about, with chronic use, so 6 months or more, it lowers the effectiveness of those meds for TB, HIV, and cancer, different immunosuppressive drugs. The nursing implications, number 6, we said that you want to assess the frequency of common mild illnesses in response to use, educate about chronic use. Christine found that usual therapy is about 10 to 14 days, with 8 weeks being the maximum. So that chronic use of 6 months or more is definitely, we're more than likely going to cause interactions. You also want to monitor for allergic reactions and hypersensitivity, like most Western medications. And you also want to seek treatment for illnesses that do not improve after taking echinacea. Additionally, you'll want to do medicine reconciliation related to specifically treatment involving antivirals, and also just educate about storing it away from sunlight.
Oh, okay.
And number 7, so we picked reflexology related to helping the common cold. So a bunch of us kind of found different information on the internet about this. I think Carol was the only one that had heard about it and used it. But essentially what we found was that there are complementary points on the feet, face, and hands that correspond with different areas of the body. So for example, rubbing your thumb between your fingers works the lymphatics and helps to stimulate the nervous system and supposedly help clear the sinuses, which is obviously important if you're coming down with a cold. Also, so something that I found is that there's also a reflex point on the ball of your foot that when stimulated, it may relieve soreness in your chest. So help to open your lungs a little bit, help you breathe a little bit easier. And somehow they believe that the soreness in your feet is related to the soreness in your lungs. And lastly, reflexology aids in relaxation and relieves stress within the body. That's all we had.
Okay. Okay, so echinacea is a fairly common alternative that people do take because the common colds, they want to try and fight it. And you, just like with any of these herbs or these medicines that people take, even though they're natural, they do have interactions with regular medicine. And in this case, actually decreasing the effectiveness of the antivirals and medicines for TB. So that would be, reasons to make sure in medication reconciliation that you include asking about alternative herbal remedies that people take. Very good. Okay. All right. Now group 2. Who's
Okay,
group 2?
so, this is Phyllis. We had anxiety in our group.
Mm-hmm.
So we picked meditation as our therapy. For number 2, what does the research show? That meditation and progressive muscle relaxation have shown benefits in the treatment of anxiety. Why is it used for the problem? Because of the studies and trials that were done, we actually looked for more of an evidence-based article. Did show that it did improve anxiety and depression in the patients that meditation was used. Some pros and cons of the therapy. Pros, faster recovery from stress. It can decrease the anxiety and insomnia, reduce substance abuse, reduction in high blood pressure, and it can also be used for pain reduction. And then some cons, it can be difficult with patients with anxiety or stress because if they are already not able to focus, if they're not on any other supplements or medications to help them focus, then they may not be able to actually sit there and meditate.
Mm-hmm.
And also people with physical limitations, they may not be able to participate because they can't do the movements that may be involved in meditation, especially if they're coupling it with yoga. Interactions, we really didn't have any, but some of the other things that it can do, it can also be helpful for post-traumatic stress disorder, headaches, and patients with multiple sclerosis. It can reduce the stress for those. So some nursing implications we came up with were obviously if we know the patient's going to meditate, we would need to be able to provide them a quiet area, maybe dim the lights. We would need to know the effectiveness of the meditation, that it's actually working for them. So we would need to be aware of their signs and symptoms of what to look out for if they are in the middle of an anxiety attack. Maybe know the triggers that causes their anxiety. And then we would also need to know what other treatments that they may be on for their condition and stress the importance not to discontinue them with the meditation because they really need to consult with their physician. They may be on some meds that they really need to take.
Mm-hmm.
And then number 7, well, we just picked meditation.
Okay, so you stuck with the medication. Okay. Okay. So meditation is a difficult practice. And I think you mentioned that in your cons. If you already have anxiety, to sit there and try and get yourself to the point where you can actually meditate is probably very difficult. But so maybe educating ahead of time, just in general, talking about meditation as a practice before somebody, you can do that in a wellness class. So it doesn't have to necessarily be just, obviously meditation is for a lot of problems or complaints or concerns somebody has besides anxiety. So you could teach about meditation and promote meditation in a wellness class. Because I think once somebody does have that anxiety, it would be really difficult to get them into a meditation type state. Would you agree or disagree, or what do you think about that?
No,
A lot of the a lot of the articles that we researched, it had the CAM meditation technique also used with Western medicine is helpful. Like that's possible. That's one thing that you can, I guess, refer to your patient while also taking the medicine to get the maximum effects.
Okay, so actually taking medication to help the anxiety, to sort of help them calm down from a chemical perspective, and then teaching the meditation.
Right, exactly.
Okay. Okay.
Yeah, I agree. I've seen somebody in the middle of an anxiety attack. One of my daughters had severe anxiety when they were much younger.
Mhm.
So I know when they're in the middle of that attack, there's no meditation happening. It's really, they do need to know about it ahead of time, the things that they can do to try to start de-stressing themselves before they get to that panic mood.
Okay. And what would some of those techniques that you could include?
Deep breathing.
Breathing, right.
Mhm. Yeah, just sitting there thinking about something that makes them happy or takes them away from whatever's causing that stress right then. So maybe a favorite place, favorite color, things like that.
Okay, good. So sometimes rather than a deep meditative state, which really does take a very long time to practice and get to there, but even beginning with some breathing type activities to help to calm somebody down. Yeah, excellent. Okay. And I know, so we'll do group 1, and unfortunately with group 4, I missed some of the end of it because of the computer connection, but so maybe we can just circle back for a minute. But go ahead, group 1, and tell us what yours is on. Group 1? Who's your spokesperson?
Princess, do you want to talk since you have the paper or?
Sure, sorry. So ours is chronic pain, and the therapy we chose is massage therapy. And so the research shows that during massage, levels of cortisone, the stress hormone, were reduced by up to 31%. This indicates that massage is highly effective at reducing stress levels and in turn reducing chronic pain. Some of the pros are it lowers your heart rate, blood pressure. It's accessible, it's inexpensive. It's no addiction risk. It improves circulation, energy, awareness. The cons are it's not available for people with coagulation disorders, burns, broken bones, or DVT. Some interactions would be, again, you use this cautiously in people with coagulation medication because it can cause bruising, or using corticosteroids due to skin frailty. Some of the implications, yes.
If I could just cut in, I thought of another, sort of contraindication for this, which is something we discussed in Unit 1 of this class. In pancreatitis, you can have, the pancreatic abscess, which is not supposed to be deeply palpated. And I'm sure we can name a couple other conditions. AAA comes to mind, which should not be deeply palpated. And so those are also things to be aware of with massage, but it is a relatively safe intervention from what we've studied. Sorry, thank you for doing this, Princess.
Okay, and number 6, some of the nursing implications: avoid injection sites, patches, open cuts, and bruised areas. And like you said, if you have inflamed organs, you definitely want to avoid those areas. Anything else?
Did you
Number
pick
7 was
anything
kind
on
of
7 for what yours was for chronic pain? Did you pick any others? Did you see anything else in the list on question 7 that could be used for chronic pain?
Well, to be honest, no, because you said don't worry about number 7.
Yeah, because you said it should have been first.
Yeah, because you guys had that specific question. Okay, that's fine. So again, massage is used often now in complementing Western medicine, and insurance is reimbursing for massage therapy for patients in the hospital. It's used oftentimes with cancer patients because of their pain and to help cancer patients. So So yoga is something that we are seeing much, seeing, I mean, a lot of people practice yoga, and it really does help you with flexibility and then, specific things like you talked about for pain. And so that's great. All righty. And Natalie, you were talking about acupuncture for, what was your anxiety? No, what was your, so I don't have, I'm in the other room again, so I can't.
Cancer.
Yours was cancer. Okay, so what were your nursing implications? That was number 6, right?
Hang on, because mine just went out on me.
Oh, it did. Okay.
Hold on.
Is there anything?
Okay.
Go ahead.
Shoot. Okay, I'm pulling it back up. Okay, so our nursing implications, we had that you would review the medications with the patient that they're on, check with the provider to make sure it is indicated, and review the past medical history. Also refer to websites for evidence-based practice.
Okay.
That's what we had for question 6.
Chuck, you had a question about the energy, whether it would be more of an alternative or an energy. And I did look up, and it looks like acupuncture helps to release QI energy. So I was able to find a couple articles that it actually can be used in that respect, even though they don't list it as an energy therapy. Acupuncture has the ability to release some of those energy kind of fields. That's how I interpret it. So I think it could be either. So, okay. All right. So you guys have probably talked about complementary alternative medicine in other classes. Has this been included in some of your other classes? And if not, you will hear about it again, but it is an important practice. Now, in terms of the readings, Carol had asked the ATI pharmacology book. I had listed, I think, where it was vitamins and minerals, but there's another section that also talks about it under herbal. So in pharmacology, I don't have access to that ATI book. I went online to ATI to see if I could get access to it, and I couldn't. I'll be at CCBC on Thursday, and I'll try and grab a pharmacology ATI book to give you the other reading pages. And there's also in Lutz, your nutrition book, there's a section, and this is off the top of my head, but I will post it, but I believe it started at page 345 in the Lutz nutrition book, that also talks about different herbal medicines and the use of them. And Christian's group was the group that talked about an actual herbal, whereas the rest use different, energy or manipulative therapies. But one of the things about using different herbal medication and mineral and vitamins is, where is it being manufactured? Because a lot, you have to make sure you're getting it from a reputable place. Okay, so that they talk about that in the Lutz book quite a bit. So they're not all created equal. Not all herbal therapies are created equal. They come from many different places, and some of it, if you buy it off the internet, may be just fake heavy metals and other stuff that is not good for you and can actually cause more harm. So make sure, again, using the web with evidence, articles that are evidence-based, when you refer patients for more information, that people are aware that you have to really be knowledgeable about what you're getting involved in and making sure that it is from a reputable, if it's medication or herbal medicines, that they are reputable. Okay. So infections, infectious diseases, COVID-19, influenza. Are there any specific questions as it relates to that part of the lecture that was on VoiceThread? Did you guys watch the video, Building Bridges for COVID-19?
I did not.
Okay, I would recommend, it was from CBS Sunday Morning, which is on every Sunday morning at 9 a.m. And it was a feature, was the feature story about COVID-19 and how it does affect particular communities, vulnerable communities. And it was interviewing a person from Baltimore, and it talks about Baltimore and COVID-19. So, and in that piece, they talk about disparities and how to reach out and help one another. And so I would highly recommend that you watch that video. It's only like, it's not, I don't know, it's maybe 6 minutes, 7 minutes at the most. But it talks about how COVID, why do you think COVID-19 or influenza or any of these, why are certain communities affected disproportionately? What are some of the issues surrounding that?
Well, according to the video, it said that because a lot of Latinos and African Americans have like frontline positions, so they're in a position to be exposed more often.
Okay, so they're in a position of being exposed more often. So does that increase their incidence of contracting the disease?
Yes.
What else though about those particular people that are in these frontline jobs?
Well, it was also said that, because a lot of the same groups already have respiratory issues.
And what other? They have other
diabetes.
things.
They had diabetes and heart disease, I believe, as well as just their resources in the areas they live.
Exactly. So economics, health with comorbidities in areas where their stressors are higher to begin with, because the student that they specifically focused on, she was getting ready to graduate, and she specifically said, I had all the stressors, working full-time, and you guys probably, some of you can relate to this if you are holding a full-time job, as well as going to school full-time and taking care of your families. And if you live in an area where access to care may not be as available. What about an area where the foods choices aren't as you don't have full-blown supermarkets, and you have to travel further to get care, and transportation might be an issue. So all of those are stressors. When we have stress, our immune systems are compromised. When our immune systems are compromised and they're lower, we are more susceptible to contracting the disease. So when you combine all of those factors, the stress, the comorbidities, working in a frontline job, such as maybe it's a grocery store worker, or I think they showed a mail delivery person, housekeeping jobs, places where you're encountering people on a daily basis, and lots of people that you encounter increases your chance of coming in touch with somebody who has that disease. And if you already have lowered immunity, you're more susceptible. So that was just, I just thought that short video really explains very well about disparities and why certain people have a higher incidence of this particular disease. So do you understand what's the idea about epidemiology and how that works? You know, we have the agent, the host, and the environment. You have to have those three pieces in order, and that's how an epidemiologist tracks the origins of the disease. And you can be a host, but not necessarily have active disease. Did you understand how that all works?
Yeah, isn't it like based on like the prevalence and the virulence of the actual disease and your immune system?
And your immune system, right. And if you have the vaccine, so you may come across, you may contract or be in the presence of somebody who has COVID-19. We'll stick with COVID-19 right now. But if you've had the vaccines, chances of you contracting COVID-19 are going to be a lot less because you have the barrier to block that chain of infection. It won't, that organism will still enter into your body, but because you have in place either the vaccine or you have a strong immune system, whatever that could be, you won't get the disease. So that's why vaccines are so crucial, really, in helping to stop the spread of certain diseases. So that's why you take flu vaccines every year, right? Now, the flu vaccine is mostly vaccine for influenza A, but there's also influenza B. So you don't get a vaccine for both of those influenzas. You only get it for one. And just like with COVID, now they're talking about the variants, right? So what's happening is the virus, the microbe keeps mutating. It mutates. The virus keeps mutating into other strains. And so now is that vaccine going to protect against that particular strain that the virus is just mutated in? Well, it does offer some protection. And so they're really studying that with COVID-19. They're not 100% sure, but they think, at least for now, the vaccine that we have are working even against the variants, but it doesn't happen that way all the time. And the same with the influenza vaccine. So you get the flu vaccine for influenza, typically for influenza A, because that seems to be the more virulent of the two, and only A and B affect humans. If you at least had the immunity against A, chances of, if you even came into contact with somebody with influenza B, you wouldn't get as sick because you have some protection already. All right, so it's a matter of those antibodies. So and do you understand the difference between an influenza virus and a COVID virus? So they're different, right? There's the coronavirus is different than influenza virus. So just know that there is a distinction between the two, and you don't have to know anything other than there is a difference between them. And they're different vaccines against flu and of course we're just developing, because COVID-19 is a new coronavirus. It's the last two, SARS and MERS, weren't nearly as they still affected a lot of people and killed a lot of people, not to the extent that this particular COVID-19 is affecting. We have over 485,000 people in the United States alone that have died from COVID-19. You know, there's a lot of reasons for that, but one thing it proves is how we have to support our public health infrastructure. And, you know, in some ways, public health has become almost a stepchild to some of the other government programs, and it really can't be, because there are emerging new infections that can happen all the time. This is not the only one. We will see others in our lifetime. And so it's really important that we have the public health infrastructure in place to be able to deal with these emerging infections. And what are some of those things that we need to have? And we're going to talk a whole lot about, in the fourth lecture, is all about disaster nursing. And so we'll talk about more of the public health response when it comes to disasters. But in terms of infectious disease, what killed people mostly in the beginning of at the turn of the century, of the 20th century, was infectious diseases, right? And the reason why was because there were so many people coming over, packed together in ships. They were coming as immigrants to this country. They didn't have much, so they lived in tenement housing, and there were very close living quarters. And so people were dying because they were spreading disease so rampantly. The Marine Health Service started in the 1700s when soldiers were coming back, because there were close quarters and then coming and spreading diseases. Well, we got pretty sophisticated, and we had a great public health infrastructure to identify those infectious diseases and find ways to combat the spread of them. And they're the same things you're hearing now, right? Hand hygiene, wash your hands, wash your hands, wash your hands, wear a mask, social distancing. So congregate living is not a good place. Hence, we have Lord Baltimore, we have the Tri-Center, we have those in place now to help slow the spread of this particular virus, this coronavirus, COVID-19. So what happened was, as communicable diseases became less of a threat and chronic diseases became more of the reason people were dying from chronic diseases as we continue to age, I think we sort of let our guard down a little bit with public health and having the infrastructure. And it costs money to support infrastructure and be able to combat these diseases. And so, you know, that's where the political piece comes in when you talk about public health. And so now we're in the midst of this, you know, horrific pandemic, and while public health infrastructure in some ways was great, because things like the University of Maryland and Hopkins putting together that incredible initiative with the field hospital and then the hotel to help combat the disease. Not all communities have that sophistication like we do in cities like Baltimore. Okay, so in some of the rural communities, again, your access to care is already decreased. It's not near as, we don't have the same access, and the video showed that about telehealth medicine, but the access isn't there. The monies aren't there, the dollars aren't there. And so certain states, that's why it's so different in every state, how we're addressing and fighting this pandemic. So there needs to be, and hopefully there will be, better ways to address and be prepared to deal with these outbreaks. And so the nurse's role, at least at this point, is what? Is to educate, to teach our patients, to do screenings. That's what the school nurse does. The school nurse is looking, the camp nurse are looking for those outbreaks. They're reporting them. Okay. So some countries, so the incidence of TB, we all get our PPDs, right? And some of us may have a positive PPD, but we may not have active TB disease. So do you understand the difference between having TB being a carrier and having the active TB? So some people, if your PPD, it's the MAN2 test comes back, it's protein derivative, where it's just subcutaneously under your skin. So if that comes back positive, what happens? You have to go get a chest x-ray, okay? And then the chest x-ray will confirm whether it's active TB or you're a carrier and you have TB that way. So we have to, so TB in this country has been contained because we have public health initiatives in place. The therapy is medication therapy 6 to 9 months. One of the reasons why we have mutations in so many variant strains of diseases is because people aren't compliant with their medication. So with TB, especially when you think about the fact that you've got to take medicine for 6 to 9 months for TB, you're not necessarily going to take that medicine all that time. So now public health nurses go out and they have TB. They are strictly TB nurses that call on anybody who's on medication for TB to make sure that they are continuing their medicine throughout the entire length of therapy. Because as soon as they stop taking it before they're supposed to, you now have the possibility of that strain mutating and becoming antibiotic resistant. There's probably one of the scariest things to think about are antibiotic resistant strains of infection. We don't have medicines to treat certain things. And so compliance with medication regimens is essential to helping stop mutations and spread of disease. So with tuberculosis, with somebody who has active TB, they're on that medicine. We have to make sure that they're on it. So public health nurses actually go out and monitor them and their compliance with their medicine. So think about the roles that you have as a public health nurse, as a community nurse, and as it relates to communicable diseases and infectious diseases, and what we need to educate specifically about each one of those diseases, and what measures can be taken to help prevent the spread of them. So you understand what tracing is? Do you know what contact tracing means? Yeah?
No.
No? Okay, so there is a list, and CDC is your go-to website for any information in regards to any suspicious about it or any questions about any kind of diseases. But let's say you have an outbreak. You're the nurse, you're working in the school, and a lot of kids start coming in and they all have those same symptoms. So that's the surveillance piece. And then that gets reported. But I'm trying to think of one. It's a little contact trace. So the piece I want to talk about is contact tracing. So it's a little different with school nurses and kids with influenza. That's more tracking and teaching about hand hygiene and keeping those kids home when they're sick and that sort of thing. But there are certain diseases, such as COVID-19, which is, you have contact tracing, which means you need to know who are all the people that the person who has tested positive for COVID-19 has come in contact with. Because all of those people also now need to be notified that they came in contact with somebody who tested positive for COVID-19. So contact tracing is really going back and figuring out every single person that somebody's tested positive for has come in contact with. So that all those people then can be monitored, tested, medicated if needed. This is a very important component of the public health role, is to do the tracing, because if you know where all the people have been exposed and can figure all that out, you might be able to stop and slow the spread by contact tracing. They do the same thing with STDs. Have you guys had OB yet, or did you do PEDS first? Your group? Which did you have?
Yeah, OB.
You had OB. So you talked about STDs, right? Did you guys have sexually transmitted diseases in your class? You were supposed to. Yes? Did you talk about gonorrhea and chlamydia and things like that?
I think we only talked about it in relation of how they're like spread to the baby during childbirth. It was mostly we whenever.
Okay. Well, I used to include STDs in this class, but then well, anyway, so I was told I didn't need to talk about them, sexually transmitted diseases. So you had it in terms of the effects on the child. Well, just to expand a little bit to help you to understand the whole idea about contact tracing, STDs such as syphilis, gonorrhea, chlamydia, those are all herpes, genital herpes. Once somebody presents with symptoms and they are identified as having one of these diseases, that can spread through sexual contact. HIV is another one that can spread through sexual contact, also sharing dirty needles, but they're all reportable diseases to the health department, and then it's up to the health department to then contact trace all of the partners that this person has had a sexual encounter with, and then notify them so that they can be on therapy. It's like I said, it's for sexually transmitted diseases. It's for HIV, which is not only sexually transmitted, but also through, shared needles. So other body and body fluids. But it's the same with COVID. COVID-19 is a pandemic. It's an infectious disease that's spreading through contact with other people, through droplets. But we have to trace it, and that's how you try to stop or slow the spread. So surveillance, tracing, testing is huge in terms of the response, and then vaccines. So most of those, would you say they're mostly primary and secondary preventive techniques? Do you see any tertiary there?
I guess it'd be tertiary if they already got it.
If they already have it, it would definitely be tertiary, but hopefully what we're doing. So for the tertiary, what would be the response there?
Like the contact tracing you can do, because once they got it, you can now figure out like who they slept with or something, and then figure out from there.
So contact tracing though is more secondary because you want to stop the spread.
Oh, okay.
See, and so tertiary would be somebody who has the virus, and now we're going to treat them with either antivirals. They use remdesivir, I think is the name of the medicine. There's a couple antivirals that they use and steroids that they use. That would be your tertiary. Somebody already has the disease and we are treating the disease. So that would be tertiary. But otherwise, the public health initiative is more primary, secondary. So it's identifying, educating, and then vaccines and screenings and all would be all considered part of your secondary. Okay. So you need to know about your influenzas, COVID, tuberculosis, and then norovirus was the other communicable disease that we talk about in this class, and that's a waterborne, foodborne. Giardia is waterborne. But foodborne illnesses can happen. There are others besides salmonella. But think about salmonella and people in close contact. They're on ships. There's always seems to be a lot of outbreaks of salmonella on cruise ships. Because you got a lot of people in a tin can. I don't know. That's kind of what I think about when I think about cruise ships, because you can't go anywhere and you've got thousands and thousands of people on those ships, and it spreads very, 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 very quickly. So some of these, like influenza, you can be affected within 3 days, whereas COVID, it's a longer period. So before you start to show symptoms, it's 6 to 7. So what happens there is it can spread now more because people don't even know they have the disease and they're out. And, you know, they talk about these super spreader events. Last Sunday, I saw pictures after the next day of people celebrating the Super Bowl. There were very few people wearing masks, and there was huge crowds of people. So it'll be interesting to see what happens, you know, after 2 weeks. There were a lot of protests and events that happened through the summer. Some people wore masks. At most of the Black Lives Matter protests, you saw people wearing masks. At some of the other rallies and protests, people did not wear masks, and they were what they call super spreaders, because so many people in such close quarters without wearing masks. Masks stop the droplets from going out from your mouth and nose. So, so we have a lot of work to do. We have a lot of education to do. In terms of our nursing role to stop the spread of these communicable diseases. Somebody want to say something? So I had one other class activity that we still, let's see what time we've been, I think I'd like to put you back in your breakout rooms. Just take 10 minutes to go through it's in your activities, your class activities for medication management, okay? And then we'll come back and we'll report on that. And I think this one's really important because medication reconciliation is really a very critical role for any nurse, not only in the hospital, when you're coordinating and discharging a patient, or transitioning them to another level of care, but just in terms of even as a school nurse, how do you reconcile medicine, or the nurse working in the adult daycare, which are Violet and the other one's name escapes me all of a sudden and I don't have it in front of me, but that's the medication reconciliation you're going to do right now. I'll just tell you this real quick. When one of the days I was working at the Lord Baltimore at the Tri-Center, we had, we would get 15 admissions from one facility. And because there was a person in the facility who would test positive for COVID. And so all of the other residents of the facility would then come over to the hotel and go into one of the floors that they were PUI, patient under investigation, or person under investigation. And we would do testing and monitor them for 10 days while they were under investigation. But what we had to do for every one of those folks that came from these facilities, they would come in through the loading dock at the hotel. This is how we would admit them. We would admit them, they'd come into the loading dock, and they'd all have bags with their medication. And this one particular day, we had these 15 or so admissions from one of the drug rehabilitation centers. So everybody came with their Suboxone, because they were all heroin addicts that were detoxing and in rehab. And so there we were out at the loading dock at the hotel counting patients' medicines and writing everything down to do our medication reconciliation so that we knew exactly what medicines they were on and we could put them into their, because we had medical records on every one of these people. So medication reconciliation and understanding medication management is really such a crucial role for nurses that I do think this is an important activity for you guys to be involved in. So I'm going to go ahead and put you in your breakout rooms again, and I'll see you in about 10 minutes. Okay? Sound good? All right, let's see. And so I'm going to open the rooms. You're already assigned, so see you in about 10. Chris. Oh, shoot.
Hello.
Did I mess up? I'm sorry. I think I closed by accident. Ugh.
Oh, so we should still be in our rooms.
Yes, sorry. Let me rejoin you all. It's going to close. I'm so sorry. I hit the wrong button.
It's all right.
All good.
It's Monday for sure, isn't it? Dear Lord. Chris, I need to get you in your room. Sorry, this was a mistake. I'll put you all back in as soon as the time is up. I can do it. 9 seconds, 8, 7, 6. Anyway, what I have, it'll be in 2 separate recordings because when I lost everybody on the first go round, I lost that recording uploaded, and now it'll be a second upload. So hopefully, the fingers crossed, these did work, and I'll get them posted as well as your voice thread for Wednesday's class. Okay, I'll have that for you today. You all take care. Have a good day. Stay warm. Stay safe. And thank you.
Got a question.
Yes, please do.
I'd heard somebody mention about the ATI.
Mhm.
Did any,
What about the ATI? So about the
are we taking a
pharmacology.
practice?
Hmm?
Are we doing ATI A or B or?
So there should be community. I'll make sure it's open for you. There are a couple practice. Are they open, the community practice tests?
So I think the question is really that there isn't any information on Blackboard about ATI, except that we are required to take the proctored ATI test the Wednesday after our final. In every prior class, we've had to take a practice ATI assessment and then fill out a certain number of the active learning templates.
Yes. Yes.
So are we required to do that for this class? And if so, what are the due dates?
No, not, you may for 234, but not for the community portion. So your question probably needs to be directed more to Dr. Eck Elliott, who is the course coordinator. But for community specific, no, there is no ATI testing. There are a couple practice ATI community tests that I can open up for you. I will tell you that a lot of the questions you may not be able to answer simply because we don't have the time to teach a full, semester of community in 12 hours. So we touch on the highlights. And in fact, I will post on Blackboard for you guys all of the different topics that you want to be able to address and what we're looking for when it comes time for studying what will be on the exam. So I will send them. And as long as you follow the goals and the objectives for each of the classes, that will help you as well. So I will make sure those ATI practice exams for community are open. But as far as for the class. I believe there is ATI testing for 234. Dr. Eck Elliott would be the one to give you that information and to open those. Whatever you need to do for that ATI testing will come from her. Okay.
Okay, well, thank you. We'll direct these questions to Dr. Eck Elliott then.
Yeah, sounds good. All right.
Are we getting tested for the STDs or no?
No.
Okay.
Nope, I took all those questions out and have new ones for your community exam.
Also, for your content, are there any quizzes available? Or you won't be doing any quizzes?
I don't have quizzes. No, I've never had quizzes for this class, other than the ATI. Was that a thumbs up, Riley?
Yes.
Okay.
Yeah, I'm fine with not having to do quizzes.
Okay.
Yeah, I don't know.
Oh, okay. And you guys are all, you know what you need to do as far as your windshield. And we'll present them next week. Okay. All right. All right. Well, listen, have a great day. I'll see you all on Wednesday. And I should be back Wednesday in time for class. My husband had major foot surgery, so we had to go see the surgeon Wednesday morning at 8:15. And we should be back in plenty of time, but in case I am, I'll send a broadcast message out on Blackboard that we may not start till like 10:30, but I'm hoping that we should be able to get back. I have to go because I have to drive him because he can't walk, and yeah, so I'm his nurse, which is a good thing. So, all right,
All
my
right.
friends.
Thank you for that heads up, Ms. Bunting. I hope you're well, and I'll see you on Wednesday.
Thank you, guys. Adios. I'll see you later. Bye-bye.